The purpose of this video is to demonstrate the proper setup and maintenance of the external ventricular drain. One quick disclaimer, there is no compensation being received from any of the manufacturers of these devices. The first step to setting up the EVD. Gathering the equipment. You will need the CSF drainage bag, IV pole, 500 milliliter bag of sterile normal saline, pressure monitoring tubing and cable, non-vented red caps, vertical reference ruler, leveling device with bubble or laser level.
An item we didn't have on the table is the vertical reference ruler, and that's this black one right here.
After performing hand hygiene, we will now set up the sterile field and prepare the equipment, maintaining a septic technique for the purpose of the EVD flush. You will need a sterile towel,
Okay.
transducer tubing,
Comes in a package. Make sure when you get your tubing, it does not have the safe set on it. This is a special one without it.
non-vented sterile red caps,
For sake of demonstration, I'm not going to open up a new tubing. I'm going to use the one that's already been opened. This would be sterile, and we would have dropped it on our sterile field.
and a 500 ml bag of normal saline.
You would take the normal saline, open up the pack, and place it on the outside of your sterile field.
Performing hand hygiene again. Apply mask and sterile gloves.
Your mask always should go first.
We will now set up the transducer tubing. Remove the long extension pressure tubing with stopcock and discard.
All the pressure tubings come with the one that's coming off of the top is the long one. You're going to take that off, and at the very end you have the short tubing. Usually it has the little cap on the top. This is the one we're going to disconnect. And the long tubing is going to be discarded. Short tubing is going to connect to the top of the transducer. Make sure they're all connected tight. Okay, I'm going to put a red cap on here so we don't have any open ends.
Spike the normal saline bag. Remove air. Squeeze the drip chamber and never apply a pressure bag. Once the flush bag is set up, it is now time to attach the transducer to the vertical reference ruler manifold and hang the saline bag.
Okay. So here's your manifold that's connected to your vertical reference ruler, and you're going to tape it to the side here. Okay, this part, we're going to leave it open for now until we make sure that all our systems are flushed. This cap comes with a regular cap with the white one with the open end on it. They're to be replaced with a dead end cap. You want me to do it?
The transducer system will now be flushed by pulling the pigtail.
The EVD flush system is now ready for insertion. While the physicians are inserting the EVD, we're going to be preparing this cylinder for drainage.
With clean gloves, attach the EVD graduated cylinder to the vertical reference ruler.
There's a hook right here that it would sit on.
Attach transducer tubing to intersection port on EVD tubing.
So this port here, the short tubing that we originally set up before, is going to go to the air port on this EVD tubing. always be sure that the air ports are all aligned. The drainage, the flush system, the EVD tubing, and also the pressure line on your drainage bag.
You will then adjust the prescribed level centimeters of water and secure in place with the securement knob.
So here is your level, and this is at 0. You want to make sure that you're using a level, a ruler that has centimeters of water. If there are two different, always go with the centimeter of water. Here's your 0. And if the physician prescribes that he wants it at a different level above the tragus, you could just simply slide it up and secure it at, example, 10 centimeters of water above the tragus.
You will then secure the pigtail device with a dated 96-hour label. Securing the pigtail with a 96-hour label assures that no flushing can occur inadvertently, but it leaves the pigtail intact in case the physician would like to perform a flush. Also be sure that the roller clamp is now in the shut position. Once the setup is complete, it is important to draw your attention to the positioning of the stopcocks. Ensure the EVD is maintained at the prescribed height and anatomical landmark. Always ensure that the intersection port stopcock is either in the measuring or the draining position. Do not ever place in the null position.
In the position that it is now, it is closed to the pressure system, but open to the patient and to the drainage. So in this position, the patient is draining. If you want to measure the ICP, you close it off to the drainage, which means turn it up, and now it's connected from the patient to the pressure system. Now you can measure your ICP. The place that you never want to be in is the null position, where it's open to both drainage and ICP drainage pressure.
We are now going to change the drainage bag. The drainage bag should always be changed when it gets to 3/4 full. Gathering the equipment. You will need a new drainage bag, betadine swabs or a betadine bottle and a tub of gauze, sterile gloves, a mask, a sterile towel or small sterile drape, and non-vented red caps. Please be sure that the yellow stopcock is off to the drainage chamber.
It should be pointing up towards the chamber.
Remove the drainage bag from the secure clips. Perform hand hygiene. Prepare the betadine cleansing agent, either the swabs or the gauze.
You could use your tub gauze and pour in your betadine, or you can use your swabs if you have them. So I'm just going to put the betadine in there.
Open the new drainage bag package over the sterile field. Put on mask and sterile gloves. Cleanse the drainage bag connection port vigorously with betadine.
Okay. Sometimes if there's a lot of betadine on your gauze, it may drip on the floor, so prior to that you may want to put just a towel on the floor. Okay, it's all clean.
Place the new CSF drainage bag on the sterile field, which has already been done. Detach the current drainage bag.
Turn it towards the left, yeah, no, to the right, and this bag will just drop off.
You will then place a red cap on it to prevent the contents from spilling. Attach the new CSF drainage bag and secure it by pushing it up, then twisting the connection swivel. Then secure the corners of the drainage bag to the plastic attachment of the CSF drainage system. You have now successfully changed the CSF drainage bag. Thank you for watching, and we hope you got value from our video.